So adult health, musculoskeletal system, we going to talk about today. So this musculoskeletal system, we should talk about some terminology related to musculoskeletal. We will talk about the anatomy, some physiology, and finally we should talk about the musculoskeletal disorder is called pathophysiology. Also, we are going to talk the causes and prevention of musculoskeletal disorder. Before to go, the pathophysiology or musculoskeletal disorder, we're supposed to talk about the diagnostic test for purpose, description, and what are the most important for you, nursing implementation or implication or intervention. Super important. So human musculoskeletal system, also known as the locomotor system, I said, right? So this system is an organ system that gives the human the ability to move and using their muscle and skeletal system. Muscle and skeletal. Skeletal means your bones, right? The body part provide the support, shape, and protect the soft tissue. So brain is inside the skull. So skull is a skeletal system. Brain is a soft tissue. So skull gave your brain and protect your brain. So I'm telling the skeletal system protect our soft organ, and musculoskeletal system provide form, support, stability, and also most important, help to movement our body, right? So this musculoskeletal system basically made by, here you say musculoskeletal system made by the skeletal muscle, cartilage, tendon, ligament, joint, and other connective tissues. So the anatomy and physiology first. Anatomy means the structure, and definitely we are going to talk about the anatomy in musculoskeletal system. So musculoskeletal system, I said, made up of the bones of skeleton. So skeletal basically divided here axial and perpendicular. Axial means you see the longitudinal one made by cranium. This is the vertebra and ribs. Perpendicular portion or appendicular portion made by limbs, shoulder, and hip. So these all are part of skeletal system. And in this picture showing the different bones name, this is the skull, right? Skull basically composed of frontal bone, maxilla, mandible. And then these two bones together is called pectoral region, and they make by clavicle and scapula. Then thoracic case made by sternum, ribs, and costal cartilage. This is the thoracic area. So lungs shaped inside the thoracic case, brain inside the skull. So skull protect your brain, ribs protect your heart, protect your lungs. So what are the function of the skeletal system? Protect the soft tissue. And this is the vertebra, right? And pelvis made by sacrum on behind, and two side is a part of hip bones. And this is the lower extremities, basically made by femur, fibula, and tibia, right? And this is one of the biggest joint, knee joint. And small bones in the knee joint is called patella, and hip joint, another big joint in the body, and also shoulder joints. So skull, some bones, joint, they work together, right? And this is the upper extremity. The biggest bone here is called humerus, and ulna and radius in the forearms. So the musculoskeletal system anatomy is made by, or how they work, or anatomy and physiology. You know, the physiology is a function of the system. So musculoskeletal system is made up of the bones of the skeletal system, and they work with muscle, they work with cartilage, they work with the tendon, ligament, and joint. So type of the bones here, some of the bones are spongy and some are dense bone. It's called compact bones. Spongy bones means soft bones, and dense means hardest bone, like femur, humerus, right? And here showing how they work together. And as I told you, the musculoskeletal system, they have a collaboration between bones with muscle and associated with tendon, ligament, cartilage. So keep in mind, the bones are type of the connective tissue. They connected to the other bones and muscle fiber via connective tissue such as tendon and ligament. So this is the picture. You can see the bones, type of the bones. The atypical bones has divided the proximal part or proximal epiphysis, then body or diaphysis, and distal epiphysis. So the proximal epiphysis portion are spongy bones, but the body or diaphysis is the compact bones. So if you go more microscopic structure of the spongy portion or proximal epiphysis, we can get inside like this: spongy bones, outer is compact bones, and blood passing by. So bones also has a blood supply, right? The interior or inside the bones is called the medullary cavities. They contain medulla, right? Bone marrow, bone marrow. So next here. So they said the type of bones, the nature of bones, the characteristics of bones, and also the bones growth. So the character of the bones, they support and protect the soft tissue in the body. They provide attachment for the muscle, for the tendon, for ligament, and also contain the tissue in cranial cavities, and also assist regulating the calcium and phosphorus concentration. So basically, the bones, calcium and phosphorus is very important component of the bones, right? The important component of the bones. And not only the component, we have to have the equal distribution of the bones, or distribution of calcium and phosphorus throughout the bones. Otherwise, bones will be broken, And here, the bones growth, I said, the length of bones growth result from ossification of epiphyseal cartilage at the end of the bones. So if you want to find out the age of the bones, you can read the bones ossification systems. What we have to know for board exam: as the aging occur, the bone resorption accelerate. What does it mean, resorption? Means osteoporosis type of nature. By the time bones is go to under the process of erosion, okay, and because of the age, our system is going get slower, our ability of absorption going less, and bones growth should be stopped. Not only stop, bones loss this own structure. So bone resorption is the resorption of the bone's tissue. That is the process by which osteoclastic break down the tissue in bones and release the minerals, and resulting in transfer calcium from bones tissue to the blood. Now question come. What I said, you do not get me. Keep in mind, the bones contain two type of cell. One is called osteoclast, other is called osteoblast. Osteoblasts are bone forming cell. Osteoclasts are bones destroying cell or bones eating cell. When we are young, our osteoblastic activity increase, but in the disease process, when we going older, osteoclastic activity increase and they eat the bones, and bones is going through the osteoporosis. How you have to prevent the osteoporosis? Just take enough minerals, calcium, and you have to share. You have to I said take enough calcium. You have to take enough phosphorus, right? And now in this picture showing how bones remodeling or healing. If anybody's bones is broken, right, definitely we need to bones healing. Okay, bones healing, I said. So bones healing, they said bones healing means bones reunion or healing, the process that occur after the integrity of a bones in interrupted. So here I said that you can see the first picture, bones is broken, then it's called hematoma formation inside the bone, hematoma. second picture, hematoma to granulation tissue. After that, calcareous bone formation, osteoblastic activity. Osteoblast means bone forming activity, and then bones remodeling, and finally bone healing up. This is the step-by-step process of bones healing. So keep in mind, when bones are broken or broken bones go through the some of the steps, it is called healing process. And this is very true whether a bones has been cut as a part, like a patient has to go to any surgical process, right? So surgical process, I said, after the surgery, bones has to be the heal up. If anybody's bones is broken, they has to go through the process of the heal up, and this is called the steps of healing. First of all, when the tissue is getting disturbed, we say inflammatory process. Inflammation is the most important, most primary cause. And when inflammation is occur, bones is fracture and last of the several days. Finally, hematoma formation. Hematoma transfer to the granulation tissue formation, and granulation tissue then bones production, and this first is called callus formation, and osteoblastic activity increase, more bones tissue formation in the gap, and then undergo the bones remodeling. So remodeling are the final process of bones healing. Okay, and it takes several months, and finally bones is formed, and this is called the healing complete or compact bone is formed. So now going here, joint. So as I told you, if we have bones, definitely bones connected to the other bones through a joints. Okay, so through a joints, I said. So what are the type of joints and what are the nature of joints, right? So first of some of the joint are cartilaginous, some contain synovial, and some are fibrous, right? So keep in mind here, cartilaginous joint, slightly movable, cartilaginous joint. That joint what is contain the synovial fluid, they easily to move, okay, and this is called synovial joints. Example, ball and socket joint, like hip joint, they permit to free movement, right? So another joint is called fibrous, means fixed, like the brain joint. Okay, so no movement associated with the joint, and this is the called fixed type of nature. So joint basically, I mean, a joint is a combined or combination of one or two joints together, and that some type of joint are movable, some are not. The usually fixed joint are fibrous, and the ball and socket joint, which permit to move, they contain the synovial fluid, and some are slightly movable, is called cartilaginous joint. So let's go in the picture here. So in this picture, this is the example of fibrous joint, right? Fibrous joint are not moved, fixed. Is it possible you can move the frontal bones or occipital bones? No, they are fixed. Cartilaginous, they slightly movable. If you want, you can move your spine little bit side to side. And another joint is very movable, like ball and socket joint, hip joint. You can do the extension, right? You have to do lateral rotation, medial rotation here. So also in this picture showing the type of joint here, different example in the body, different like ball and socket, ellipsoid, pivot, saddle, hinge, and here showing the characteristics of the joint. Characteristics of joint. So characteristics of joint, they allow the movement between the bones. Character of the joints, basically they united together, and but not only united, some are allowing to movement of the joint, right? And also the surface are covered by cartilage, enclosed in a capsule, contain the cavity. The cavity is full by the fluid. Ligament is hold them, and articular is a meeting. So if you have a look on this joint, what we can see, like this is the union of two joints, right? In between the two joints, there are fluid, and it's called synovial fluid. So synovial fluid covered by a synovial membrane. And this fluid also work as a shock absorber, right? Two joint attached with the ligament, and this ligament can help to movement of the joint. So what are the synovial fluid here? Found in the joint capsule, and this area is covered by a soft tissue, and this make a capsule, sometimes called articular articular surface or joint. Though formed by the synovial membrane, lubricate the cartilage and provide the and work as a shock absorber, and also, or you say, caution against the shock. What next? The muscle. So as I told you, the musculoskeletal system work together with the muscle, right? So muscle, keep in mind, muscle are four categories. Muscle: cardiac muscle, then smooth muscle, and skeletal muscle. So cardiac muscle basically we found in the heart, right? And smooth muscle we found in our internal organ, such as blood vessel, gastrointestinal system, urinary bladder, uterus. And smooth muscle basically controlled by autonomic nervous system, means it is not our control. Like you eat something, after eating you can't say my stomach don't digest it, your stomach will not follow your comments. So it is not your control, involuntary smooth muscle. Cardiac muscle is another type of muscle found in the wall of the heart, and it is also not your control, involuntary, or under control of autonomic nervous system, right? And the heart muscle has a property of contraction and relaxation. So the contraction of the cardiac muscle is involuntary, strong, and rhythmical, right? It's nature of the cardiac muscle. So cardiac muscle is very special. So smooth and cardiac muscle will be, I said, not our control, right? But the skeletal system, skeletal muscle is under our control, right? So as I told you, in our body, there are three types of muscle basically. One is cardiac muscle found in the heart, and there's a smooth muscle found in the blood vessel, gastrointestinal system, bladder, uterus. Both are autonomic nervous system, controlled by autonomic nervous system. But skeletal muscle attached to bones and responsible for skeletal movement, right? And the peripheral portion of the central nervous system control the skeletal muscle. And skeletal muscle under our control. So it is called voluntary control. This the nature or character, the basic unit of muscle fiber with many nuclei, and this muscle fiber are striated. So they said made up with a bundle of muscle fiber, skeletal muscle, bundle of muscle fiber, and provide the force to move the bones, assist the maintaining the posture, and assist with heat production, right? So the process of contraction and relaxation, muscle contraction and relaxation require the large amount of adenosine triphosphate. Adenosine triphosphate, from where we can get it? By metabolism. Where metabolism take place? Liver. And by the metabolism, what are the raw materials we use for the metabolism? Glucose, fatty acid, amino acid. From where we can get glucose? From carbohydrate. Amino acid we get from protein, and fatty acid we can get from fatty food or triglyceride can provide it. And ATP I produce by a series of chemical reaction, right? In presence of enzyme. And enzyme work in optimum pH. So contraction also require calcium. So calcium is very important for heart muscle, very important for skeletal muscle, very important for skeletal system, which work as a catalyst. Also, acetylcholine released from the motor end plate. Acetylcholine is that destroyed by acetylcholine esterase. And here, the process of contraction and relaxation of the muscle. So what we learned from previous, calcium play very important role for the contraction and relaxation of the muscle, right? So here, calcium is required to contract the muscle fiber and act as a catalyst. So if you in NCLEX board, if you get a question, what can help the muscle to contract and relax muscle fiber? Calcium, right? Also, contraction is occurred because of adenosine triphosphate allow the actin and myosin to separate, allow the muscle to relax. The skeletal muscle are attached to bones and cross the at least one joint. The point of organ is the point of attachment that does not move. The point of insertion is the point of attachment that moves when muscle contraction. So here, like here, this is the muscle, right? And this is the tendon. So they attached with the bones, and this is the ligament or tendon attached with the bones as well. So here in this picture showing the structure of muscle. So this is the muscle tissue, right? And inside the muscle we can get so many fibers, okay? And the fiber, if you go inside, there's so many actin and myosin work together, okay, and activate the system. So here showing the histology of the muscle system and with physiology. So the step-by-step process showing myosin head hydrolyzed ATP, myosin bind to actin. So actin and myosin is a muscle fiber. They can help to the movement of muscle because of their mechanism of action. So myosin and actin play a major role in the contraction and relaxation of the muscle. So in this flow or picture, flow chart, you can get how myosin and actin work. More accurately called actin filament. How associated with myosin are responsible for many types of cell movement. Basically, myosin is the prototype of a molecular motor and protein that convert the chemical energy in the form of ATP. ATP to mechanical energy. And this is the way muscle get force to movement or contraction and relaxation. And here showing the skeletal system how work basically. Let me go through. We have done here. So skeletal muscle. We are talking about the skeletal muscle, not cardiac muscle, not smooth muscle, because this is musculoskeletal system. Skeletal muscle act in a group or work as a group. The prime movement contract to produce the movement, also antagonist relax, and also nerve activate and control the muscle. So now here showing some of the risk factor associated with the musculoskeletal disorder. So here, what are the risk factor impaired our musculoskeletal system? Most threat or dangerous is the autoimmune disorder. So in this system, we are going to talk about some autoimmune problem. Autoimmune means antibody is produced without any external stimuli. If any bacteria, virus, or any pathogen attack us, our body is produce antibody. But some unfortunate patient, or antibody is produced without any external pathogen. An antigen antibody reaction, and they make antigen antibody complex materials and they eat our organ. Usually autoimmune disorder affect our multiple system in the body. So autoimmune disorder is one of the risk factor for musculoskeletal system. Calcium deficiency, okay, maybe from the food or body do not absorb the calcium, or if we suddenly fall, and fall is most important in elderly patient. If you prevent the fall, you can prevent 90% accident in the long-term care. Hyperuremia is another important factor of the risk musculoskeletal system disorder. Infection. There's so many diseases in musculoskeletal system related to the or precipitate the infection. Some medication like long-term steroid taking, they cause osteoporosis. Metabolic disorder impaired your musculoskeletal system and rapid up the osteoporotic change. Some bone cancer like neoplasia, also risk factor for musculoskeletal system. Obesity rapid up the osteoporosis, and some hormone also causes the osteoporosis, or most important, the trauma or injuries causes the musculoskeletal problem as well.